procedure. So I'm going to go through everything I do, and Kelly's got some areas we're going to do it all today, right? So Kelly's done this before, so she knows what to expect. But Botox traditionally is for the lines in your forehead. They go across this way. That squinch down now. These lines that make the 11s, or these vertical frown lines, and raise up your forehead real high. These lines that go straight across. Now Kelly doesn't have bad lines in that direction. Also, squinch like you're in the sun. So when she's squinching, the muscle that goes in a circle around her eye, called the orbicularis oculi muscle, makes crow's feet. Hers are not bad. Now smile. So a smile, this muscle that goes from here to here, elevates the cheek up and makes some crow's feet. On Kelly, it's not so bad. Now don't smile, just squinch. That's that muscle around your eye that makes crow's feet. Hers are really not that bad. Squinch again. Like what Kelly has, and I notice right here, is that when she squinches, she gets lines right here. Right now, because she's young and her skin is still very elastic, when she relaxes her face, those lines completely go away. Those are called dynamic creases, meaning that they're there only when the action of the muscle is happening. Botox will completely erase dynamic wrinkles, because what Botox does is it relaxes the chemical relaxation of the muscle that prevents it from contracting. Contracting the overlying skin is what makes the wrinkle. In time, if Kelly never did Botox and she just continued to go out in the sun, which I'm sure you don't do, but go out in the sun without sunscreen, because she's listened to every word that I've told her through all the years we've known each other. So she's got great skin, and it's all good. But if she went in the sun and started losing elasticity in her skin, what we would see is that in time, the lines that she gets in that make a frown would not disappear when she relaxed, and those are called static creases. At first, with Botox, static creases won't disappear, but if you keep up the Botox and don't let that motion come back, those static creases will eventually fade as well. But for Kelly today, what we're going to do is really to prevent lines from forming. So I'm going to lean her head back here. So my first thing, Kelly came in to me today, no makeup on, so that it's easy for me to clean her skin, which is nice of her. But I'm going to clean all the oil and dirt off the skin, which invariably comes with just being outside. We're going to treat her crow's feet, even though hers aren't bad, just to kind of demonstrate what the procedure is and what we do. But we're really going to focus in on these bunny lines, because she's got those pretty strong. When she smiles, she crinkles up her nose, so she gets funny lines, little lines by the side of the nose. Right now they're cute, but in about 20 years they're just going to look like something out of Star Trek. So.
And Phil is here saying hi, girls.
Hi, Phil. All right. So raise up your eyebrows, Kelly. All right. So when I first do Botox, Botox doesn't even start working for about 3 to 5 days. So you can relax. So the injection is an educated guess as to what we're going to get. So I really want to be very conservative on our first injection. Then I like to wait 2 weeks so that I know the Botox has taken its full effect. And then I have people come, so Kelly will come back in 2 weeks, and I'll be able to assess what the Botox has done to start to finish, and then I can add a little bit more. The reason I'm conservative in this first injection is because I can add more in 2 weeks, but I can't take it away. Once it's in there, it's in there. So I'm going to be real careful with that. And raise up again. So what I want to do is, when I'm doing a forehead and this muscle, you see it's elevating the eyebrows. When I get rid of the motion in this part of the muscle, she's not going to be able to lift her eyebrows anymore, so relax again. So I want to still have her able to move the lateral brow out here so that she gets a little bit of lift on this lateral brow. So when she starts to activate that muscle, elevate again, she gets a little lift on the muscle. Now, if it makes a funny peaking of her lateral brows, that's the kind of thing that I'm going to touch up at that 2 week mark. But chances are she's going to be okay with it, and we won't get any peaking of the brow. Or sometimes people think they look like who's the
Groucho Marx?
Well, Groucho Marx, no. But who's the evil witch in Sleeping Beauty? I can't remember. You need to know that.
Maleficent.
Maleficent. That's right. So sometimes people feel like they look like Maleficent when their eyebrows come up like that. That is not something that has to stay. That's the thing that we get rid of at that 2-week time. Sometimes people don't like the lines that stay out here. Those are some of the things that I adjust at the touch-up period. And in time, once I've learned the way that somebody's face behaves with Botox, and I keep a chart of it, when you come back, you don't have to come back at that 2-week period for a touch-up, because we already know how your particular facial features respond to the Botox. So what I've done is I've marked in this muscle, which elevates the brow, the places that I'm going to put the Botox, and now make a frown. This muscle is a little bit of a different muscle called the corrugator. You can see the edges of it here and here. So I want to get rid of the action of that muscle so that she doesn't have that line anymore. Now wrinkle up your nose, and you could see right here and here where I'm going to get rid of those wrinkles and lines around her nose. And then we're just going to take care of the little crow's feet that are just here and here. And once I've planned out the procedure, so that's all the planning I do. I'm looking, it's very specific to each patient. Not everybody is Kelly, and not everybody has the same facial motion that she does or problem areas. So everybody's going to be a little bit different. It's certainly not a cookie cutter procedure for each person. So I like to plan everybody individually. So they're tiny, tiny little needles. It is multiple injections, but I'll do some pinching so that Kelly doesn't have very much pain. And from 1 to 10, Cal, how would you say this pain?
Like a 5.
5? All right,
Probably
Kelly's
not even.
not even a 5. Yeah, it's not bad. I do my own Botox, so I can tell you it's really not that bad. If you can put a needle in your own face, it's not too bad. All right. What's worse, this or a vein laser?
I'm pretty comfortable.
Okay.
It's all what you can tolerate.
Yeah, you're pretty good, huh? So once we get the marks done and the plan done, it's super quick. So our forehead's already done. If we were going to stop there, some people, it's all they do, their forehead. My typical injection to start in a forehead is going to be 30 units of Botox. I charge by the unit on Botox, not by area. That way it's very fair. You only pay for what you get, and you only get what you need. So if there is a touch-up for this needed, and the vast majority of people do not need touch-ups, I'm pretty good at guessing, an educated guess as to how much people need and how they're going to respond to the treatment. But if there is a touch-up required, we do charge for those. It's by unit. And here we are going into the crow's feet. So what we're doing is we're targeting just the orbicularis oculi muscle, which is a circular muscle that acts like a sphincter around the eyes and kind of gathers and pinches the skin and makes the crow's feet. We want to avoid that smile muscle, which runs from here to here, because we don't want to affect the lip movement. So if people have a lot of crow's feet based on their smile, they're not going to completely get rid of their crow's feet with Botox, but it'll certainly soften the lines. Come around here. To me, the peri-orbital injections are a little bit more sore, but Kelly's doing great. And that's it. So that's Botox. So now we're going to wait 2 weeks. Kelly will start to notice that the movement will start to get weaker in those areas by about 3 to 5 days. She'll have complete action of the Botox by 2 weeks, and that's when she'll come back and see me. And then we'll touch it up. So stay tuned. We'll add that day and let you show you what we got out of this. And thank you, Kelly.
Thank you.